I'm Dr. Sara J. I'm director of the Center for Aging and Behavioral Research and also a professor of gerontology in the Division of Geriatrics and Palliative Medicine at Weill Cornell Medicine. Weill Cornell Medicine has a long-time commitment to health, well-being, not only of their patients, but also family members of their patients. A special area of emphasis has always been on family members who provide support or care for someone who has an illness or a chronic condition. At our programs at the center, we also have an emphasis on providing support for family members or caregivers. So I'm going to talk to you today a little bit about caregiving just to provide some background for the work that we do. And then I'm going to introduce a very special program that we're doing in our Center on Behavioral Research that's supported by the National Institutes of Health that is geared towards providing support for family members or informal caregivers. Okay, I'm going to specifically talk about the role of technology in supporting family caregivers. This is our special program at Weill Cornell Medicine. And again, I really would like to thank the National Institutes of Health and the National Institutes on Aging who are supporting this program. Let's talk a little bit about caregiving. We at our Center on Aging and Behavioral Research, and generally throughout the country, if not the world, we recognize that informal caregivers are a key component of our healthcare system. By informal caregiver, we mean caregivers who are not paid. These are typically family members or friends who provide support to someone that they know with a chronic illness or disability. Currently in the United States, there are about 44 million caregivers who are providing care for an older adult or someone with Alzheimer's disease or a related dementia. We know that caregivers are very diverse. Caregivers are not all alike, and that's very important when we think about how we design our programs. Certainly, caregivers vary by their race, ethnicity, and cultural background. There are male caregivers, female caregivers. They vary according to their socioeconomic status, their level of education, their relationship to the person for whom they are providing care. It may be a spouse, it may be a mother, a father, an aunt, a cousin, and the nature of their caregiving experience. This varies greatly, of course, with the context of care of the illness or condition that the person they are providing support for has. We also know that the landscape of caregiving is changing dramatically. Because of changes in our healthcare system, more care for people with chronic illnesses is provided at home, and the bulk of this care is provided by informal caregivers, which is why earlier I stressed the fact that we consider informal caregivers as key members of our healthcare system. We know that the duration and intensity of caregiving can be increasing because of the fact that more people with chronic illnesses are receiving care at home. We also know that caregiving can be quite complex. If we want to think about caregiving tasks, obviously these change. What caregivers do changes over where they are in the course of their caregiving trajectory. Are they just beginning to provide support for someone, or have they been providing support and care for an extended period of time? They also vary according to the caregiving situation. They vary if, for example, if the person is providing support to someone who has Alzheimer's disease or someone who has, for example, a spinal cord injury. But we know that caregiving tasks are many, and they can include activities surrounding care coordination. Coordinating care between primary care doctors, specialists, maybe therapists like physical therapists, and trying to manage insurance companies. For example, understanding if certain benefits are qualified for reimbursement. If so, how do I apply for this reimbursement? What process do I use? This can be very, very stressful, especially now when many of these programs and services are online. Caregivers also get involved in helping the person they are providing support for with personal care tasks such as bathing, dressing, grooming. They may even have to help the person eat. Household tasks, help with shopping, finding transportation, managing finances. Many times, caregivers are not only doing this for the person for whom they are providing support, but also for themselves at the same time. Many caregivers, as I indicated, are providing support for medical or nursing tasks, such as managing medication or operating medical equipment, which many times is very complex to use, or using monitors or some sort of assistive device. And of course, they're providing emotional and cognitive and behavioral support, such as helping with feelings of depression or isolation. Caregivers of patients with Alzheimer's disease often have to manage behavioral problems or problems with wandering, where the person they're providing support for wanders out of their residence and somewhere in the neighborhood, or helping with everyday memory activities like reminding someone of someone's name or where they put something or how to get from place A to place B. Certainly, caregiving is very complex, and caregivers get involved in a number of support activities. So we know, because of the complexity of caregiving, that there are consequences associated for someone who is a caregiver or in a support provision role. We know that there are positive experiences. Many caregivers experience personal growth, or they're happy for the opportunity to give back to someone who perhaps provided support or care for them in the past. We also know that the health and the needs of family caregivers are often overlooked, and many experience negative impacts such as depression, anxiety, sleep problems. In fact, caregivers use prescription drugs for these conditions more so than non-caregivers or the rest of the population who are not in a caregiving role. Many caregivers, because they're so involved in caregiving activities, tend to neglect their own health, and they're at risk for physical comorbidities themselves, such as high blood pressure, hypertension. Caregiving may also result in disruption in family relationships, social relationships, or in employment. Some caregivers have to switch to part-time work or leave work roles altogether because of their caregiving responsibilities. Because of these consequences, there are many programs available now to support caregivers. Certainly, the organizations like CaringKind are at the forefront of this. CaringKind, which you can access through their helpline or their website, offers many programs of support for caregivers, including social work services, education and training programs, support groups. They have a wanderer safety program, which is particularly pertinent for caregivers of patients with Alzheimer's disease, the Together We Care program, and a very innovative program, the Connected to Culture program, which allows caregivers to participate in cultural activities throughout New York. Now I'd like to talk to you about an innovative program we're doing at Weill Cornell Medicine. This is called the Care Partners Program. And again, this is a research program that is supported by the National Institutes of Health and the National Institute on Aging. The program is a very innovative technology-based program. It's an intervention program designed to improve the quality of life for family caregivers and patients with early stage Alzheimer's disease or memory problems. This is what the home screen of the program looks like, just to give you a sense of the types of topics and activities involved in the program. I'll go over this in a bit more detail now. In terms of innovation, the program is highly innovative. It has a component for both the people who are providing support as well as the individual receiving support. And there are components of the program where people work together, the support providers and the individuals receiving support. The program is delivered in the home using laptop computers. We provide the computers to our participants. They get to keep them at the end of the study. Our participants never have to come to Weill Cornell Medicine. The whole program is delivered in the comfort of their homes. Our participants we also provide internet for the duration of the study, and we compensate our participants for when they complete our assessments. Assessments involve evaluating the program, and they're a very important part of the study, as assessments provide us information about program likes, dislikes, what works best, what components need refining for future versions of the study. So assessment is an essential component of this research. And as I said, participants are compensated when they complete our assessments, which are also done in the comfort of one's home. The focus, as I said, is on early stage memory loss, and the program is available in both English and Spanish. The intervention, as I mentioned, is delivered at home. There's a component for the support person and for the person with memory problems, and then there are activities that people do together. Here's some of the features of the program. We have video conferencing skill building sessions. These are sessions that are done individually between the support provider and our trained interventionists. We talk about things like caregiving skills, how to access resources in the community, what to expect as one transitions throughout the caregiving role. There's a blog where caregivers can communicate with other caregivers. We have educational and skill building videos, relaxation and pleasant event videos. For example, our pleasant event videos include virtual tours of the Rubin Art Museum and of the New York Botanical Gardens, stress management activities, information about resources available in the community. There are also cognitive engagement activities for the person with a memory problem, as well as an organizational tool to help people remember important phone numbers, to-do lists, upcoming events like birthdays, anniversaries, doctor's appointments. And we also have video conferencing support groups. These are done, again, caregivers participate in the support groups from the comfort of their home using the technology that we provide. This is what the homepage looks like. As you can see, every day there's a very pretty picture. There's the date, the time, there's a caregiving tip of the week. These are some of the features. To access any of the features, you simply click on the name of the feature on the sidebar menu. This will give you just a snippet of what types of information is available with respect to stress management. We have skill building videos. These are videos that actually help people manage their stress, like engaging in meditation, progressive muscle relaxation, or deep breathing exercise. We also have a learning video about stress and the importance of engaging in activities to manage stress, and then information tips related to stress management. The topics that are discussed in the program build up gradually over time, and people are able to review any material that they've already learned simply by touching on the topic, which provides links to videos and information related to that topic. For example, early on, we talk about how to use the organizational planning tool, and if people want to refresh themselves on how to use it, they simply would click on past topics and select use of organizational planning tool. And finally, this just gives you a sense of the types of resources that we link our participants to. They select them in terms of the type of support that they would like. It might be financial support, it might be legal assistance, they might want to know more about local organizations that support caregivers or persons with memory problems. So I'd like to thank you very much for your attention. And if you have interest in participating in our program, please call us at 646-962-7141. Someone from our team will get back to you. Even today, in the middle of the COVID pandemic, you can call that number and we will talk to you about our program. Thank you very much.